Hello, my name is Sumaya. Today I'm going to be talking about and covering quality methods in healthcare. What is a QI plan, or in other words, a quality improvement plan? A quality improvement plan is a detailed and overall organizational work plan for healthcare service quality improvement. The QI plan in many organizations is also developed by clinical and executive leadership and approved by organization's governing body. The tool can be used to measure the level of quality that is delivered to obtain favorable outcomes to meet the satisfaction of patients. Where did the quality improvement plan originate from? Well, the first QI for healthcare was developed and used by Florence Nightingale. She applied the plan to observe data and track effects of changing practices on patients during the Crimean War, which put thousands of lives at risk. The value of this practice promoted its adoption from warfields to civilian setups, thus helping hospitals and nursing facilities today. Why were quality improvement plans created? Well, quality improvement plans were created to recognize issues affecting quality in healthcare. Issues such as neglect, med errors, and falls. These prompts were poor outcomes in regard to quality delivered by hospital personnel. These outcomes were a direct result of a quantity of variables, such as staff shortages, burnout, and few resources. Quality improvement plans are also the best interest of patient safety and satisfaction, as well as a healthy work environment. Quality improvement plans also attract potential patients and produce favorable outcomes for hospitals and other organizations alike. What are quality improvement principles and quality methods in healthcare? The fundamental concept of QI originates from an organization's efficiency. This means the primary principle or basic principle is maximum patient satisfaction and experience. Other principles include improving safety of patients, reducing probability of med errors, improving clinical competency, improving hospital structure and workflow, promoting efficiency in communication and work coordination, reducing waste, promoting equability in services to ensure timelessness. To obtain favorable outcomes in QI methods, we must first examine areas of improvement. According to the Institute of Medicine, the improvement initiative should target time, safety, efficiency, effectiveness, equitability or fairness, and patient-centered. Timelessness. This means reducing waiting time to eliminate harmful delays. For safety, we should only provide safety to the intended patient to avoid injury. So this means following guidelines to avoid incidences that may lead to consequences such as death, med errors, and lawsuits. Efficiency. This means avoiding waste and maximizing resources. For effectiveness, services should follow scientific approval and offered only to likely beneficiaries. Do not offer to non-beneficiaries. For fairness or equitability, service quality should not vary from person to person. For patient-centered, patient care should be respectful and responsive to their value and preferences. There are a number of advantages for QI plans. QI plans and programs outline the professional obligation for non-clinical and clinical departments such as doctors, clinicians, nurses, and all healthcare personnel. QI plans identify problems such as falls, med errors, and neglect, and formulate solutions to improve efficiency and patient satisfaction. QI plans also improve patient health, process, and healthcare outcomes. Aside from that, QI plans prioritize patient health needs and enhance managerial efficiency. QI plans also help manage and reduce waste and organizational costs that result from recurring system failures. QI plans also measure QI process measures are useful for tracking feedback that is a necessary tool to initiatives for quality improvement. Although there are a number of advantages of the quality improvement plan, there are some disadvantages. Quality improvement plans are generally expensive to implement because it requires training and execution from all staff members. Quality improvement plans are not a quick fix. It may take years to obtain favorable outcomes or see results. Quality improvement plans call for a change in the entire organization. Sometimes it is difficult to see or implement these changes due to non-compliance in department organizations. What are some developmental strategies for QI measures? There are approximately 3 that I have listed in this slide. The first one is QI systems should enable care management systems to evaluate quality improvement procedures and outcomes. The second is to provide information for improvement of specific processes, and this could also mean isolating problem areas to enhance and provide the highest quality of patient care. And the third strategy is to make QI data collections be part of routine by caregivers and staff. And this means surveying and obtaining feedback of care that was provided. Although Chaparral Regional Hospital is a small hospital of approximately 60 beds, it's important that our facility utilizes a QI plan. The facility needs a QI plan to outline the areas for clinical focus in the current and preceding years. The plan will define the roadmap for quality service delivery both for operational and clinical services. For example, medication safety for medication reconciliation on discharge. It will provide a formal plan for ongoing processes and provide objective measures for monitoring patients. For example, timely access to care for monitoring wait times for complex patients. It will also help address challenges with behavioral and oral healthcare services and facilitate systematic approaches to identifying and pursuing opportunities for improving and resolving identified health problems. Both Chaparral Regional Hospital and organizations alike need to keep in mind that quality improvement is a framework. Quality improvement is a key concern of all healthcare sectors. Organizations and healthcare providers need to ensure quality improvement in all aspects of healthcare operations. All healthcare providers and management staff need to learn and apply QI programs and apply them to improve service quality to cut down on burdens that result from poor quality services that make patients dissatisfied.